Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider.
Hi, and welcome to episode 161 of the Untethered Podcast. This is your host, Hallie, and it's me and you today. Yay! So, what are we going to talk about? This is a big topic. We're going to talk about choking versus gagging. Before we jump in, I do want to mention that we have our next pediatric feeding screening training, like learn how to screen your first ped feeding patient, coming up May 16th through 20th. And you're going to want to go to feedthepeds.com/training, and that will get you on the list so that you get all the updates, you know, where we're hosting the training and all those fun details. They'll tell you everything you need. Okay. So make sure you do that. Doors to Feed the Peds, our next round of the course, will open between May 23rd and 27th, 5 days only. And the course starts on May 26th. So mark your calendar, get on the wait list. You can also go to feedthepeds.com to get on that wait list. Wanted to let everybody know because everyone keeps asking, when is the next course starting? So it's starting soon. But I wanted to go through the differences, and this is going to be a quick episode today because this is just really a great informational episode on the differences between gagging and choking. And the reason why I want to cover this is because I so often see parents worry about their children's skills and say, oh, my baby chokes a lot. We had this choking episode the other day. They choked and then they vomited. Well, that is possible. That can happen. But whenever I've seen videos following, these explanations, it's actually usually a gagging episode. And sometimes they're more severe than others, right? So let's cover the 9 differences between, we're going to go right through them and then I'll review them at the end. But with gagging, it's going to be loud, okay? Versus choking, that will be quiet or silent. Gagging, you're going to have a baby's mouth usually open and their tongue is going to thrust forward. They're trying to expel that food. Whereas with choking, a baby's mouth will open, but their tongue is not going to come forward. They're going to be a little bit helpless in that regard. With gagging, a baby might like cough or sputter or gurgle or make some type of noise trying to expel that, that food. And with choking, the baby or liquid, could be food or liquid. With choking, a baby will struggle to cough. They may not be able to cough at all, depending on the level of obstruction. With gagging, oftentimes the baby may fuss or cry, whereas with choking, the baby won't cry. If they try to make any noise at all, they're probably going to sound like they're struggling to make a noise. With gagging, there's no trouble breathing, okay? But with choking, baby will have trouble breathing. They might make a high-pitched sound even because of the airway obstruction, depending on how obstructed they are. With gagging, the face often turns red, whereas with choking, the face or lips, and the skin might become blue or bluish. With gagging, the gag reflex is protecting the baby from choking, whereas with choking, the baby's airway is blocked, okay? With gagging, we want to let the baby work this out on their own, which I know is the scariest thing for so many of our parents, but intervening can actually lead to choking. Okay. They need to develop the skill. Now with choking, baby needs you to intervene, right? We need to intervene immediately and try to dislodge that, the food from, generally it's going to be a solid piece of food, right? Or item from the airway. And I'm not going to sit here and teach you how to do that. That's not the point of this episode. But with infants, I highly recommend taking a CPR class because the way that you do CPR on a baby is going to be different than an adult. And they also teach you what happens when a baby's choking, because you have to turn the baby over to their belly. And there's a certain way that you lay them across your knee and use the back part, use the palm of your hand to, bring it to their back and help to dislodge that item from their airway. So really important skill that I recommend all parents make sure they learn how to do if you're a parent or parent to be for a young infant, but providers, especially all of you medical professionals that work with these infants and even toddlers, definitely should be trained in this as well. And then gagging is a normal part of these transition periods and weaning, right? We might be transitioning from just solely being on breast or bottle to introducing solids. It could be, they're using their hands to feed themselves, or using a spoon or a fork, a utensil. Maybe they're drinking from a straw cup or an open cup now, right? There's different things going on that may lead to gagging, and part of that's normal, but it shouldn't continue indefinitely as the child gets used to this new, introduction of food, this new transition to all these different utensils and cups and different ways of getting nutrition in their body, right? Whereas with choking, it's not normal, and it might be life threatening. So it's a lot more serious, right? So let's review. I told you this is going to be a super fast one today. We're going to do some short ones like this just to give you some really great tidbits over the next couple of weeks. But the biggest things to know, and I didn't mention this, but with gagging, we might see the eyes get a little watery as well. So with gagging, the airway's clear. You'll hear that noise, right? It might be this loud noise, or like a cough or a sputter or a gurgle, but they're breathing. They're likely going to be red in the face and trying to push that food out. Their tongue may come forward, right? And it's a normal reflex. It's not something we want to get rid of. It's a protective mechanism. So in some babies, and even in some adults, that gag reflex may sit too far forward in the mouth for any number of reasons. We often see this with tethered oral tissues, like a tongue tie, for example, where the reflex didn't move far back enough. Maybe it's like halfway back on the tongue, where we want it like all the way to the back third of the tongue. But with babies, in all these transitional periods in their first year of life, they should be moving that gag reflex back, especially as they're starting to mouth objects and items, and whether they're eating from their fingers or spoons or a little baby fork or something, or they're chewing on chewy tubes or toys or other hard objects, really great for their jaw. But those things are the things that move the gag reflex back. Again, you never want to get rid of it. You just want to move it back. Okay. But we don't want to panic. We want to stay calm and let them work through it. Maybe silently count to like 10 in your head and just observe them and just remain very calm while they work their way through it. Okay. This is compared to choking, where, the baby may have like a panicked look or a blank stare. They're going to have a blocked airway. So they'll be silent, right? They're not breathing. They'll turn bluish in the face and the skin and the lips, maybe because of the lack of oxygen. This is not normal, right? And then this is an emergency. So we need to intervene immediately and seek help. Okay. The one thing I will say, and I don't have like the names of them in front of me, you can go and Google this and see what you can find, but there are little things I know, because some parents are very anxious about this, and rightly so. There are little like tools and things that some people will keep like in a diaper bag or in the car or somewhere, that basically has like a mask that goes over the nose and mouth, and a little thing that you pull, and it will help dislodge something straight out of the airway, and it can work on children and adults. So, if this is something that makes you really, really anxious, definitely have something like that on hand, and it will definitely make you feel a lot better. I haven't seen it work in like person in real life, but I've seen it on videos of like real people having to use things like this with infants specifically, and they do appear to work really well. So definitely something good to have on hand, and probably one of those, Googleable type of devices that you can buy relatively cheap usually too. So I hope this is helpful. Again, if you're an SLP or OT, join us. If you haven't done this in the past with us, or come hang again, you're always welcome to rejoin us at feedthepeds.com/training. We are going to do the free training on how to screen your first pediatric feeding patient using my children as your models. And you're going to see one child who has really great feeding skills, and I'm going to do that screening. You're going to see that whole thing, and you're just going to fill it out and everything. And then we're going to screen my other child together who has not so typical feeding skills. The challenge will run from May 16th to the 20th, and the cart or doors, if you will, to Feed the Peds at feedthepeds.com will open between May 23rd to May 27th, 5 days only. And we start that course on May 26th. So make sure you go to feedthepeds.com/training to get on the list for all the details for the free training, and then go to just feedthepeds.com to get on the wait list for the full course. I have enjoyed sharing this information with you. This is a not so light topic, but one that I definitely wanted to make sure we cover on the podcast because like I said, this question comes up so much and it's really important, critical information that we should have out there and accessible to practitioners and parents. So everybody have a wonderful day and we will chat with another short episode next week.
Thanks for listening to this podcast. If you want to hear more of these Myo, Tots, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts or pledge a small amount on patreon.com/the Untethered Podcast. If you found value, others you know in this space will too. So be sure to share this episode on your social media platforms and join us over on Facebook, on my Facebook page at Hallie Bulkin Biz, on Instagram at Hallie Bulkin, and you can head over to theuntetheredpodcast.com to grab a copy of the show notes, where you can also subscribe to be kept up to date on the latest podcast episodes.